Hi viewers, welcome back. In today's video, we are going to discuss about the types of AV aids. So when you come to the types of AV aids, you have two major varieties of AV aids. One is the projected AV aids and the other one is the non-projected AV aids. Okay, so projected in the sense like you are projecting it on the wall or on the screen so that it is visible to everybody. So that is your projected AV aids. The other AV aids, non-projected AV aids, are like you are not going to project. It is either already available, you prepare, you carry with you. Okay, so that is your non-projected AV aids. Okay, so sometimes you get a question, the types of AV aids. So you have to tell what is AV aids, the purpose of AV aids, and then you have to discuss about the types, that is your projected and non-projected AV aids. Okay, when we come to projected AV aids, we have films. So films in the sense like the films that is like we are getting projected in the TV or in the big screen, that is your films. So nowadays your trend is like changing, you have your short films, all these are available. So when you want to tell a concept, you are taking films as your AV aids and then you are conveying that concept. And then comes the film strips. Film strips, I don't think nowadays you would have seen, sometimes like maybe you would have seen cameras and they have that small film strips will be available. Okay, so these are the film strips. Like in olden days, these film strips were being used to project things and to show to the audience. That was like in olden generation, it was like with film strips only they were, you would have seen reels. Like when you say, like you would have seen in movies that they carry reels and they take it to the theater for projecting, that is your film reels. Okay, that is like your film strips. And then comes the opaque projectors. Opaque projector in the sense like you will have slide like things will be placed. Okay, you will have a round a material, that is like you will have projector, that is your projector, and these slides will be placed one by one, and like every time when one opaque slide is coming, it will be projected and like it automatically it will move and the next slide will be projected, that is your opaque projectors. Okay, and then comes your OHB projectors. OHB projectors you would have been familiar, everywhere you can see, even in your classes, in your colleges they would have used. So that is your overhead projector. So you carry your pen drive, you prepare PPTs and like you can carry. So that is also available. Your PPT projectors are also available. Your overhead projector is your, like you will have a glass sheet, transparent sheet, you write in that transparent sheet and then you will have a projector, you keep it under the projector and it will be reflected on the wall or on the screen. Then comes your slides. Slides are nothing but your PPT, that is your PowerPoint projectors. Okay, so PowerPoint preparation and that will be projected. So these are your projected AV aids. So you have films, film strips, opaque projectors, OHB projectors and slides, that is with your projected AV aids. Next we have the non-projected AV aids. So in non-projected AV aids we have 5 categories. So one is graphic aids, display boards, 3D aids, audio aids and activity aids. Okay, so in the first one, that is your graphic aids, we have cartoons. Okay, cartoons are nothing but you would have seen images, that is like in newspapers and all you would have seen images. Okay, so that is like one cartoon is conveying some information regarding the cleanliness, environment, sanitation. Then sometimes like it is like stories, comic books. So like that you will have cartoons which is saying some informations. And then we have charts. Okay, so charts are nothing but like you have your like white charts, that color charts will be available and you will write informations in that and that will be projected to the students so they can understand with the charts. And then we have comics. So comics are nothing but similarly like your, I said like cartoons. So cartoons, like similarly you will have comic books like which is going to give some information, where like 2 cartoons are speaking like that you will get informations. And then we have diagrams. So when we are coming to diagrams, you can have a simple pictorial representation, that is like a baby, you draw a tree and you tell like these are the like purposes of using vegetables, and like you have a sun and you tell the advantages of using sunlight. Okay, so this is like a pictorial representation, that is your diagrams. And then comes your flashcards. Flashcards are nothing but like carryable charts, like this simple charts, you will cut down these charts and you will make it as flashcards and you will be using them for your regular teaching. Okay, that is your flashcards. And then comes the graphs. So that is like your graphs, graphical representation. You can use a pie diagram, a bar chart, like that you will have different types of pictorial representation, that is your graphical representation. Okay, and then comes your maps. So maps, it is not new for us, you know how we have learned maps in your small classes. Okay, so you learn about this India, the cultivation, the crops, the production, the utilization, the export, import, states, and all those things you will be learning with these maps. And then comes the photographs. Photographs, like you would have seen like the famous leaders. Okay, so like Abdul Kalam and your Ambedkar, Mahatma Gandhi, Nehru, all these like photographs and images where you are using to teach children. And then we have pictures. So pictures is like images telling a family, joint family, nuclear family, a parent, a father, mother. So all those are pictures which is predicting or which is going to inform children what it is. And then coming to the postures. Postures are again a type of AVAs, like which is your like your charts. Okay, but postures will convey many informations at a time. So now imagine when you want to talk about environmental sanitation or like a COVID, you want to talk about a COVID. So when you talk about COVID, so your postures will represent what all are there in this COVID. So that is like COVID, what is the organism of COVID, how does it spread, how you have to go in for hand washing, how is your safety precautions, like how do you take a nutritious diet. All these things comes under your poster presentation, where your poster presentation tells everything about that condition. So when you come to graphic aids, you have your cartoons, charts, comics, diagrams, flashcards, graphs, maps, photographs, pictures, and your postures. Then we have display boards. Display boards are nothing but boards, and in boards we have different types of boards. So first one is blackboard. So blackboard is a very familiar board, we would have seen from our childhood onwards. So your teacher will be using a chalk piece to write in this blackboard. And then comes the bulletin board. Bulletin boards are also familiar boards, like where you would have seen in offices, inquiry areas, like where you notice boards, like where you pin up papers. Okay, they are called as bulletin boards. And then coming the flannel boards. Flannel boards are like you are supposed to prepare images, that is like you will have a image and you have to have a double sticker, or otherwise you will have a flannel paper we say. So flannel papers are like your velcro papers that you will stick behind those pictures, and you will have a board with the like part like where it sticks over the velcro. Okay, so that is like soft area where you have to stick those velcros. Okay, so you will attach this pictures. Okay, so that is called as your flannel board. And then comes the magnetic boards. So magnetic boards you would have seen like where you will have small numbers or alphabets that is having magnets in behind that. So you are just supposed to have, so if you want to write your name, you will write your A, B, and like you can keep all your magnetic boards on those like boards which will stick on the magnetic boards. Okay, so then we have your whiteboard. So this is like your whiteboards, like where you will be using different color pens to write your content. And then we have red boards. So red boards are also available where you would have seen in hotels, receptions, your principal's office, like where you would have seen all these red boards. So where they used to post pictures and like stickers, notices, informations to be given. Okay, so that is with your display boards, which contains your blackboard, bulletin board, flannel boards, magnetic boards, white boards and your red boards. Okay, then comes 3D aids. Okay, 3D aids are like models or images. Okay, 3Ds are like you are trying to give the real image to the audience. So that is your 3D images. So it can be a diagram. So diagram saying if you want to draw a chart on a tree. Okay, so a tree, you make a tree, you cut down from the chart and you will tell, so this is the root, this is the stem, all those things you will be explaining. Okay, so that is your diagrams. And then comes the models, a similar image. Okay, that is like the model of a brain, the model of a heart, the model of a kidney, all those things are your models. Mock-ups are also similar like your models. Okay, and then we have objects. So objects, so instead of models and mock-ups, you take the real objects, that is like a vegetable, a fruit, cucumber, carrot, like that you show, that is your objects. And then comes the puppets. Puppets are dolls. So toys you will have, and those toys will be telling you how you will be using like when you want to convey an information, that is like a doctor speaking, a nurse speaking, patient speaking, like that you will have different type of puppets to show. Okay, and then we have specimens. Specimens are like, again you are having models. Specimens are like models, so again that you will be using to have 3D images. So you have 3D aids in you have diagrams, models, mock-ups, objects, puppets and specimens. So with this we finish 3D models, and then we have audio aids. In audio aids we have only audio and not the video. Okay, so AV aids is your audio visual aids, where here in audio aids you have only the audios available. So that is your radios. So radios, you would have known radios, songs. Nowadays you are hearing your songs. Okay, so you like in like previous, like olden days, you would have seen a small box like a thing, that is like radio, where you will have saved content. You can use cassettes in recordings, and that you will be having. And then we have recording. So recording, so nowadays you have your CDs, your VCR players, your pen drives, and nowadays like so many recordings are available. And then your television. So television, again the very comfortable way of communication. So televisions are also one of the AV aids. Okay, so this is your audio aids. And then we have the activity aids. So activity aids is like things like to be done. So that is like you are doing activities like which is going to teach you. So one is your computerized. Computerized is in the sense like they will do a demo and that will be projected. That is your computerized procedures, like showing how you do a lumbar puncture, how you do a bladder training, all those things, like it is like computerized. Okay, and then we have demonstration. Demonstration is nothing but what your teachers are doing in the lab. So that is your demonstrations. And then we have dramatics. Dramatics, even in your school times you would have seen, that is like a celebration of Independence Day, that is like you prepare a skit, that is your dramas. And then we have experimentation. Experimentation is your checking of acid, alkaline, your urine testing, all these things are your experimentation procedures. And then we have field trips. So we take you to field trips, that is like you are taken to educational visit, like milk diary. Then like so many educational visits you go, orphanage home, old age homes, and like juvenile delinquent houses. All these are field trips which are going to give you informations. And then we have programmed information, that is like already recorded information. So programs, like how you will be using all these things. And then we have teaching machines. Our teaching machines are nothing but your simulators. Okay, so you have simulators. When you are doing procedure on those simulators, you can see the result, that is like administration of IV, blood transfusion, conduction of delivery, all these things, like you will have simulators, CPR machine, all those things are available, so which will give you an clear image. Okay, so with this is you complete your activity aids, which includes your computerized demonstration, dramatics, experimentation, field trips, programmed demonstrations, the teaching machines or simulators. Okay, so with this we finish our projected and non-projected AV aids. Hope you understood the class. In case if you have any doubts, give your comments in the comment box. So from next video onwards, we will be discussing about these topics, like separately we will discuss. Okay, till then, take care, bye.